narrowed coronary artery may develop new blood vessels that go around the blockage to get blood to the heart muscle. However, if you're pushing yourself or stressed, the new arteries may not be able to bring enough oxygen-rich blood to the heart muscle. The plaque could rupture, leading to a heart attack or sudden cardiac death. From a young age, plaque can start to go into your blood vessel walls. As you get older, the plaque builds up, the inflames the walls, and raises the risk of blood clots and heart attacks. The plaque makes the inner walls of your blood vessels sticky. Then other things like inflammatory cells, lipoproteins, and calcium travel in your bloodstream and mix with the plaque. In some cases in which plaque ruptures, a blood clot may block blood supply to the heart muscle. This causes a heart attack. If a blood vessel to the brain is blocked, usually from a blood clot, an ischemic stroke can happen. If a blood vessel within the brain bursts, most likely as a result of uncontrolled hyperextension, high blood pressure, hemorrhagic stroke may result. Studies have found that taking low-dose aspirin each day may help prevent heart attacks and strokes in people who are 50 or older and at risk of heart disease. If you smoke, quit. Avoid drugs, processed foods, and adopt a low trans fat, low salt, and low sugar diet. Keep your blood sugar in control if you have diabetes. Exercise regularly, but talk to your doctor before starting an exercise program. Okay, immune system, asthma. If you have asthma, your airways are inflamed. They become even more swollen, and the muscles around the airways can tighten when something triggers your symptoms. This makes it difficult for air to move in and out of the lungs, causing symptoms such as coughing, wheezing, shortness of breath, and or chest tightness. For many asthma sufferers, timing of these symptoms is closely related to physical activity, and some otherwise healthy people can develop asthma symptoms only when exercising. This is called exercise-induced bronchoconstriction, or IEB, or exercise-induced asthma, EIA. Staying active is an important way to stay healthy, so asthma shouldn't keep you on the sidelines. Your doctor may develop a management plan to keep your symptoms under control before, during, and after physical activity. Symptoms: shortness of breath, chest tightness or pain, chronic coughing, trouble sleeping due to coughing or wheezing. Asthma symptoms may be worse during exercise, when you have a cold, or during times of high stress. Children with asthma may show the same symptoms as adults with asthma: coughing, wheezing, and shortness of breath. If your child has one or more of these symptoms, make an appointment with an allergist, immunologist. Coughing that is constant or that is made worse by viral infections happens while your child is asleep or triggered by exercise and cold air. Wheezing and whistling sounds when your child exhales. Shortness of breath or rapid breathing, chest tightness, fatigue, problems feeding or grunting during feeding. Avoiding sports or social activities, problems sleeping due to coughing or difficulty breathing. Treatment: there is no cure for asthma, but symptoms can be controlled with effective asthma treatment and management. This involves taking your medications as directed and learning to avoid triggers that cause your asthma symptoms. Your allergist may prescribe the best medications for your condition and provide you with specific instructions for using them. Okay, lymphatic disease, lymphangitis. Lymphangitis is an inflammation of the lymphatic system, which is a major component of your immune system. Your lymphatic system is a network of organs, cells, ducts, and glands. The glands are also called nodes and can be found throughout your body. They are most apparent under your jaw, in your armpits, and in your groin. Organs that make up the lymphatic system include your tonsils, which are located in your throat, spleen, an organ in your abdomen that purifies your blood, among other functions, thymus, an organ in your upper chest that helps white blood cells develop. Infectious lymphangitis occurs when viruses and bacteria invade the vessels of your lymphatic system, typically through an infected cut or wound. Tender red streaks often radiate from the wound toward the nearest lymph glands. Other symptoms include fever, chills, and a sense of illness. it is treated quickly, lymphangitis often goes away with no ill effects. If left untreated, complications can occur and the condition can become very serious. What causes lymphangitis? Lymphangitis may occur if you already have a skin infection and it's getting worse. This might mean that bacteria will soon enter your bloodstream. Complications such as sepsis and a life-threatening condition of your body-wide inflammation can occur as a result. Conditions that increase your risk of lymphangitis include diabetes, immunodeficiency or loss of immune function, chronic steroid use, chickenpox. There are also non-infectious disease of lymphangitis. Inflammation of lymph vessels can occur due to malignancy. Breast, lung, stomach, pancreas, rectal, and prostate cancers are common types of tumors that can lead to lymphangitis. Lymphangitis may also occur in those Crohn's disease. Other symptoms include chills, swollen lymph glands, fever, malaise, or general ill feeling, loss of appetite, headache, aching muscles. How is lymphangitis diagnosed? To diagnose lymphangitis, your doctor will perform a physical exam. They'll feel your lymph nodes for checking for swelling. Your doctor may also order tests such as biopsy to reveal the cause of swelling or a blood culture to see if the infection is present in your blood. How is the condition treated? Treatment should begin immediately to keep the condition from spreading. Your doctor may recommend the following: antibiotics, pain medication, anti-inflammatory medication, surgery to drain any abscess that may be formed, surgical debridement or removal. What complications of lymphangitis? Lymphangitis can spread quickly, leading to complications such as cellulitis, bacteremia, sepsis, abscess. It can also increase pain or redness at the site infection, growing red streaks, pus or fluid coming from the lymph node, fever over 101 degrees Fahrenheit for more than 2 days. Kite.